In Illinois, just about 1,700 new cases of COVID-19 have been reported in the last 24 hours, along with 35 new deaths. The case positivity rate is now 3.3%. Nearly 300,000 people are now fully vaccinated in the state. Of those fully vaccinated, about 55,000 are in Cook County, and that's about 2% of the population.
And so for more on the efforts to get shots into more arms, the senior medical officer of Cook County's Department of Public Health, Dr. Kiran Joshi, is joining us. Doctor, thanks for checking in. We appreciate your time here. First of all, let's start with the number of vaccines. As statewide, we're averaging almost 52,000 a day, but Illinois is lagging far behind. Can you tell us your estimate of where our state stands and what we need to do to improve?
Yeah, thanks so much for having me. I would want to emphasize to viewers that tens of thousands of doses of vaccine were administered to suburban Cook County residents just last week. And we're seeing that as we watch our data, that number is increasing day over day. That is, we're getting more shots into arms every single day. So just in suburban Cook County, 163,000 residents have received at least one dose of vaccine. And I think that's huge progress in a very short amount of time.
Doctor, what are we doing to make it fair and equitable, especially in the Black and brown communities where it is the virus is affecting most folks? I mean, we're hearing that people are coming in from the suburbs to the city getting vaccines, and that's pretty much taking vaccines away from those who really need it.
Well, look, I think our overarching principle is that we don't want anyone to be turned away. Our focus, though, is, of course, on suburban Cook County residents. That's the vaccine allocation that we get. And it's really anyone who lives or works in suburban Cook County, we shall vaccinate. Regarding equity, we have tried to be intentional from the very beginning about who we partner with and where vaccine sites are located to ensure that access is equitable throughout suburban Cook County.
So how do we make it better?
We're thinking every day and watching the data every day to see what uptake looks like and responding to that. We're moving very, very quickly to expand vaccinator capacity. Of course, we can only expand as quickly as we get more vaccine. And so that's really the rate limiting factor at this point.
Many in the state have been pointing to, the past administration for the shortfall in rolling out the vaccines. Illinois is doing what it can and facing obstacles here and there. So I want to get your assessment about that, and also, the variants and how effective. I mean, it's one thing to get the vaccines out, and now these variants with evidence saying that perhaps it's not going to be as effective. Can you address that?
Yeah. So look, hindsight is always 20/20. We at the Cook County Department of Public Health are always focused on the here and now and what we're doing on a daily basis to ensure and protect the health of the public in suburban Cook County. Regarding the variants, yes, we are certainly concerned. We've been reading the same media reports that you all have. And I think the emergence of these new variants and some of the concerns that have been raised about potential resistance to vaccines does certainly give a lot more urgency to the need to get as many shots into arms as possible.
What about the Johnson & Johnson vaccine, which would be a one-dose vaccine? Is that a game changer?
It potentially is. As you mentioned, it's one shot. The storage and handling requirements are much more straightforward and simple. As you know, Johnson & Johnson has submitted for an emergency use authorization from the Food and Drug Administration. I believe they're going to be going in front of the FDA later this month, and we're waiting the results and the outcomes of that meeting and hope those will be positive.
Have you been cataloging or taking note of some of the anti-vaccination propaganda that's out there, or is that not something that's really in your focus of concern at this moment?
Yeah. When it comes to some of the disinformation that we're seeing out there, I think it's really important to fight fire with water. And how do we do that? It's with the facts. It's very clear, having reviewed the evidence, having reviewed the FDA filings that both of the currently approved vaccines have submitted, that these trials were conducted thoughtfully. They were rigorous, and it's really clear that they are both safe and effective.
All right, Dr. Joshi with the Cook County Department of Public Health. Thanks for your time and insight. We appreciate it.
Thank you so much. Always a pleasure.
All right.